Today I'm going to speak to you about, living with glaucoma. I'm sure you could tell me probably a lot more than I could tell you, but about living with glaucoma in terms of what we do at Lighthouse Guild to help people who have, issues, whether it's vision or related issues connected with glaucoma. Lighthouse Guild, I think you've probably heard of the Lighthouse or the Jewish Guild. Last time I think I was here was about 4 years ago. 5 years ago, the Lighthouse, which was on the east side, merged with Jewish Guild Healthcare, which had been Jewish Guild for the Blind. What that means, and they were on the west side. Right now, our headquarters is on the west side of Manhattan, 64th Street and West End Avenue, but what's most important is that we combined our resources. And we had some programs that were similar and then some that were unique to us. And it made a lot of sense that we combined the resources to really deal with the challenges that are facing people who have vision loss, so that, well, you heard our mission pretty much in the intro, but we're all about addressing vision loss, but also preventing vision loss. And that's really, we're about preventing vision loss, and even if you have vision loss, to prevent disability or excess disability if it can be. And we really aim to provide people who are at risk for or affected with vision loss to make sure that people have access to all the resources that are needed to lead full, productive, and independent lives. Now, just a little bit more about our services, and then I'm going to get into a little bit more about glaucoma and how it affects vision and also function. We do have a broad spectrum of vision services as well as healthcare services. And that's what's different from how things were, years and years ago. We do provide services to people of all ages, and we provide direct services in all 5 boroughs of New York City, but at the same time, we are providing national training programs and support programs. I'm going to talk a little bit about that later. But really, the way it's evolved has been matched with what's going on in terms of need. When the Lighthouse started in 1905, the Jewish Guild started a few years later. We were committed at that time to helping people who were blind. We remain committed to helping people who are blind. Lots has changed in 100+ years, so that, first of all, we always provided services for people of all ages, but what's changed, certainly over the last several decades, is that there are fewer people who are totally blind with no vision. There are more people, however, who have diminished vision. Thanks to advances in medicine, in what we know about lifestyle, people are living longer, and as I'm sure I don't have to tell you, the longer you live, the more possible it is that you'll develop conditions like glaucoma and other eye problems as well as other health problems. And of course, glaucoma can happen at any age, but I know it's more common as we get older. So, talking about vision, and this is just kind of an overview of what happens to vision for everybody. By the time, even if you've always had perfect vision, by the time we're about 45, 50 years old, everybody needs what? Glasses for reading. Exactly. Now that's an expected part of the aging process, and the reason for that is that our eyes don't have as much elasticity as we get older. Kind of what's happened to my skin. It doesn't bounce back as quickly as it once did. But basically what that means in terms of vision is that it's harder to adjust from seeing things far away to close up and from close up to far away. These are expected parts of the aging process. And if you get an eye exam to make sure there's nothing else going on, you get a prescription for glasses, you're fine in terms of your vision if there's nothing else going on. So difficulty with that, and other changes that happen as we get older. Our eyes don't allow as much light into them. So, and we also don't adjust as quickly from a dark room to a light room and vice versa. I mean, it was really obvious to me, or it was sort of illustrated to me, even though I knew that when it's happening to me a little bit, but a few years ago, actually, I was with my mother who was in her 90s, and she hadn't been to the movies in a long time during the day. It was a bright day like today. We went from the bright day, 3 o'clock around in the afternoon, into the movie theater with the low lights, and she couldn't see for about 10 minutes. And that was scary. After 10 minutes, it was okay. But that's what happens as we get older, and that's also related to difficulties with contrast, which can be compounded if you have glaucoma. But with difficulties with contrast, you can have trouble differentiating similar colors or shades of the same color. Now that could be a fashion challenge, like when I wake up in the morning, if there's not enough light, I could put on a navy blue sock and a black sock. But it can, yeah.
That all the time?
Yeah, and I have that trouble increasingly. But it can also create safety problems, like when you're on the sidewalk outside and it's a light gray, you're approaching the curb, and the curb is leading to the street, which is a slightly darker shade of gray. If you have trouble with contrast and you don't know how to accommodate or adapt, you can not know to step, how you have to step, and you can fall. And in fact, falls, especially in older adults, falls resulting in hip fractures are much more common in people who have undetected, untreated vision problems. And actually, for other reasons also that could be related to glaucoma. I assume if you're all here, you're all up on your medical eye exam. But I do always emphasize the importance of having regular eye exams at least once a year. If you have glaucoma or you're suspect, or the doctor may well recommend coming back more often than once a year. But that regular eye exam where they put the drops in your eyes is so important, because they can tell not only if you have an eye disease in its early stages, when it's most treatable, but it will also tell you and the doctor if you have other health problems, heart problems, high blood pressure, diabetes. All of that is revealed. It's like getting a mini physical, because all the veins, all the blood vessels that run through the body run through the eyes. So, talking about glaucoma specifically, and I know again, this is sort of like preaching to the choir, but glaucoma isn't really one disease, but it's usually associated with chronic elevated eye pressure, damage to the optic nerve that sends messages from the eye up to the brain. Usually there's no pain associated with glaucoma, and not only is there no pain, but in early stages you either don't have any loss of vision, or it's around the edge, around the periphery of the vision, and that's what we depend on for navigation, but we don't think about it. Like when I'm looking straight ahead, I'm seeing whether there's something on the floor that I need to step over or around. If I had a deficit in my vision in that area and I didn't know it, I could easily not adapt and fall and hurt myself. And that's another reason that undetected, especially undetected glaucoma, can lead to a lot of difficulties in terms of safety. Also, people with glaucoma, in addition to losing side vision, I mentioned loss of contrast as we get older. That can be even greater in someone with glaucoma, and contrast is something that isn't checked for in a regular eye exam. It is part of a low vision exam, and we not too long ago, we get a lot of referrals from ophthalmologists who are doing everything they can medically for a patient. We got a referral from a glaucoma specialist for a patient who was having trouble reading. Now, the doctor said her vision in terms of clarity was 20/25. It was almost perfect. She had no field loss, and he was puzzled as to why she was having trouble reading. Well, it turned out that her contrast was very poor. And contrast can make a big difference. Even though when you're in the eye doctor's office, you're seeing the chart or you're looking at the projection on the screen, and that's ideal conditions in terms of contrast. Real life isn't like that, so if you're reading a newspaper, for example, and the print is small and it's also like a charcoal gray and it doesn't contrast very well with the paper, which is like a lighter gray, your vision may be clear, but if contrast is diminished, you'll have trouble reading. And we were able to help with this woman by putting certain tints in her lenses, so that was enhancing her contrast ability. But in any case, with glaucoma, 90%, most glaucoma-related blindness is preventable if the condition is caught early. And I'm sure you know the most common treatment are the eye drops, in which, depending on what medication you're taking, are taken once or multiple times a day. Some surgeries that can help to alleviate the eye pressure. The important thing, though, is to catch it early. And glaucoma is often called the sneak thief of sight for two reasons. One is that you don't feel any pain, so it can sneak up on you. It can also literally sneak up on you because you're losing peripheral or side vision, which isn't that obvious. Well, I talked about some of this, how glaucoma affects visual function. The slide on the right depicts how things might look. It's kind of probably more distinct than what happens in reality. But inability to see things outside of the central field of vision. And as I said, diminishing side vision, which can make it difficult to get around safely. Difficulty in seeing in low light, which I mentioned, and also difficulty adjusting to low light or bright when you go back and forth, and decreased contrast. I was ahead of myself in my comments. So, if an individual has advanced glaucoma, what are some of the challenges? As I mentioned, difficulty seeing curves or changes in surfaces as you're outside other obstacle, fear of accidents because of loss of peripheral field vision, poor night vision. As I mentioned, it could be difficulty reading, which people don't often associate with glaucoma. Difficulty even with magnification, a decreased response. So if you try to use like a standard over-the-counter magnifier, it might not work as well. Inability to differentiate colors, which I mentioned. Colors, especially when they're similar, reduced contrast, need for light, and difficulties with compliance. And I know that's a very big issue if you're taking a lot of different drops. And even in terms of how to, it's difficult to take eye drops. I mean, literally to do it. And I know that some people in doctors' offices, will help people learn the easiest way to take the drops so that you can benefit from the effects. And then, very important, but depression related to vision loss, especially when it's happened recently. So, what can be done to help people with glaucoma adapt to life and to live with vision loss? And the services that we provide, as I'm sure a lot of you know, are under an umbrella term of vision rehabilitation services or low vision rehabilitation services. What we do is, for people who have any vision at all, from minimal problems with vision to people who only have light, can only tell light and dark, we help people to make best use of whatever vision they have. And we help people, importantly, adjust to vision loss or blindness. And we do that by introducing skills, strategies, and increasingly technology to maximize function, to maximize the individual's ability to do what they need to do and like to do in their individual daily lives. And that's very important because everything we do is customized, very individual, because two people can come to us with the same diagnosis, even the same level of vision, yet what we recommend and provide in terms of services can be very different depending on their lifestyle. The services are provided at home, in the community, and also at our headquarters on the west side. So, what is low vision? It's such a generic sounding name that sometimes, a person will say to me, I have really low vision until I put my glasses on, and then I see fine. Well, if your glasses are correcting your vision, you don't have low vision. The definition of low vision and the services that address low vision connects with vision loss that cannot be corrected to quote-unquote normal with medication, surgery, or with regular eyeglasses or contact lenses. So, and really our goal is to make sure that everybody is benefiting as much as possible from standard medical treatment and conventional glasses. If you are still having a difficulty with the tasks that you do in your daily life, then that would be an indicator of a low vision problem. It's a functional loss. It's all about how you function in your environment. Even people who are legally blind can have low vision. In fact, most people who are legally blind do. A lot of people hear the term legally blind and they get really frightened, understandably. But legally blind means that your vision, you have a severe vision loss, but you can still have a significant amount of usable vision. In fact, the definition of legal blindness, there are two possible criteria that can deem a person legally blind. And I'll get into that in a minute. But really what legally blind means is that you would qualify for certain services through the government, through New York State. So the two criteria for legal blindness are, in the better eye, the vision is no better than 20/200, and what that means is that a person with perfect or corrected vision sees at 200 feet. A person who's legally blind, that's how they see things at 20 feet. The other criterion is also in the better eye, and this is relevant for people with glaucoma, that the vision is no better than 20 degrees in terms of visual field. So if you can really just see straight ahead, even if you're seeing really clearly, if your vision is 20/20, but you can't see around the periphery, you can be deemed legally blind. Now, the important thing is that any vision you have is usable vision with potential for rehabilitation. You know, when we talk about rehabilitation for things like, if you break your leg, you get occupational therapy or physical therapy. If you actually break a bone, everyone understands that you need rehabilitation. If you have a problem with your eyes, rehabilitation can help also, and that's something that we've emphasized for many decades. Usually the first step in vision rehabilitation is a low vision exam. Now, the low vision exam is different from a regular eye exam. In fact, I should point out that the largest group of referrals we get are from ophthalmologists and a few optometrists, but particularly glaucoma specialists and retina specialists, because that's where people are going when they have a specific diagnosis. And because they know that they're doing everything that can be done medically, surgically, and in terms of prescribing glasses. But if the individual, like I mentioned, the glaucoma specialist who recommended the woman to come to us because he knew, everything I can do makes it look like she's got good vision, but she's still having a problem. So that's when doctors refer patients. We don't require a doctor's referral, but I just want to differentiate the low vision exam from a regular eye exam. Our low vision specialists are eye doctors with additional training in low vision. And the exam that they provide is considered a functional exam. You spend close to an hour one-on-one. If any of you had a low vision exam? Probably. Okay, yeah. I know, yes. I know. And a few of you. Anyway, with the low vision exam, the doctor spends, like I said, a good amount of time with you one-on-one, going over not only how clearly you see and your field and contrast, but they'll also spend time going over what do you depend on your vision for? What are the visual cues that guide you through the day, and where are you having difficulties? That's the important thing. What do you depend on your vision for that you're not able to do now, or you're having increasing problems doing? So they will ask how patients interpret facial features, street signs, print, other cues, and generally assess your overall visual function to help you make best use of remaining vision. Often that involves prescription of optical devices, and I have several samples here. Some of them are high-powered glasses, like this one right here. Some are magnifiers. This is a lighted magnifier. Sometimes it's, like I mentioned, it could be a tinted lens, or it could be tinted frames that you wear over your regular glasses, and there are different colors that this comes in. Sometimes this is one of my favorites, this little space-age device that was designed for watching TV. They're called Max TV glasses, but they've actually helped a lot of other people do reading and other activities. They're adjustable. And then there are also what are called field expanding devices. If you have loss on peripheral vision, we could prescribe a lens that helps to enlarge the visual field. Like I said, it's very individual. And actually, increasingly, there's also non-optical illumination. I'm just looking at everything that's here. Other things that we have, and in your kits, you should each have a signature guide. This is a very simple little device, but if you're having trouble with contrast or seeing where to sign, say, a form, or even if you have tremors, so if you have other issues other than vision, this can be helpful. People use it for reading also. And these signature guides come in other shapes. There's one that looks like a check with holes where you need to, fill things out on a check. Very, very simple, but can be very important. Helpful devices. We can help to connect people with audiobooks. That's something, if you're having any trouble with traditional print, you probably know here in the city, there's the Andrew Heskel Library, but you don't have to physically go to the library. You can register and you'll get free equipment as well as free audiobooks. We'll help people with lighting, also insulin gauge, and I'm going to talk a little bit about diabetes because there's a large number of people with glaucoma also have diabetes, and that's connected with vision also. Now, increasingly, people are using technology. Besides the devices that I'm showing you here, the magnifiers. Now, some of the devices, closed circuit television, are designed for people who have trouble with traditional print, but increasingly, these devices that a lot of people have, smartphones, tablets, have features on them that can be beneficial if you're having a vision problem, not only in terms of enlarging the type, but also reading what's on the screen. In some cases, if you have trouble, say, with black on white, they can reverse it to white on black. And, we help people, if they have these devices, we can give some basic training on how to access the features on those devices. So, as a result of the low vision exam, in addition to recommending devices, we also provide training in the use of the prescribed devices. And I should mention something that's relatively new for us who were from the Lighthouse. We have, in addition to the low vision doctors, we have a low vision occupational therapist who's part of our team. And she's trained as an occupational therapist. She has additional training in working with people with low vision. And she will help. She has a whole room full of devices, so you can try them out, you can get training, you can try them out before you decide that you want to get one of these devices. She'll help with that, but she can also help with training, visual training. So say if part of your vision is, if you have a blind spot in a particular area or trouble in a particular area, she can show you things you can do with your vision to compensate for the loss. And we also encourage people to come with family members, caregivers, so that those individuals can better understand what the individual is going through with vision loss. Recommendation of strategies, and that's part of what the OT does, to prevent injuries and the possible loss of independence. For people who are legally blind, now sometimes people come to us not knowing that they're legally blind. So in that case, if we deem that they're legally blind, we'll explain to them what that means. But important to what that means is that it means that if you're legally blind, you're qualified to receive services that are covered by the state. So the low vision exam and a lot of the other services I'm going to talk about are covered through the New York State Commission for the Blind, as well as some of the devices that you might need. And referral to other services that we can also provide. Now, other vision rehabilitation services involve training programs, again, to help people use remaining vision to be safe, self-sufficient, and active at any stage of life. So this involves independent living skills training. Now, for that, we send people into the home for individuals who are legally blind so that they can adapt the environment and also provide training as well as devices that might be helpful. Actually, the bottom right I'm going to demonstrate. We'll go into the home. We also have classes at our headquarters. Sometimes the person will say, well, I'm not cooking for myself, so we're not going to spend, we can help people label appliances and things, but if they're not cooking for themselves, sometimes, I've heard people say, I'm not cooking, but if only I could pour my own cup of coffee, but I'm afraid that it's going to spill I'm not going to know where the top of the cup is and I'm going to burn myself. Well, this little device, has anybody seen this before? It's called a liquid level indicator, or say when. You put it on the edge of a cup. Oops, not working anymore. It makes an annoying noise when the primes touch the liquid. So that's just one example of what you can do. Also, orientation and mobility instruction we provide, and that we can come into your home. We can help you get around the community. If you need a white cane, we can provide that in instruction for navigating, whether it's in your home, in your community. For people who go to work, we'll help them with, accessing and learning how to use public transportation after vision's complicating that. Now, also in your folders, thankfully, usually orientation and mobility instruction is only covered for someone who's legally blind, but we have a grant from New York State Department of Health that if you're having any trouble getting around using transportation because of your vision, it doesn't matter what your diagnosis is even, you can get these services at no cost to you. You can get them individually. One of our specialists will come to you. We also do workshops on mobility that are part of this. It's called Operation Safe Travel. So in your kits you have information about that. And if anyone's interested, the contact information is there for the person who's in charge of that program. Other services that we have, and again, we have services for people of all ages, so we do have academic skills training, preparing for higher education. We have an adaptive technology center that's primarily for people who are on a vocational track, either keeping a job or trying to get a job. And by the way, if you're interested, if you're legally blind and you want to work even on a part-time basis, you can get covered by the state to not only get all the training I described plus the technology, you also get equipment. We had a client who was in his 80s. He was a lawyer who retired from practice, but he was teaching part-time at Manhattan College. He didn't realize, even as a part-time person, he was like 85 years old, he was afraid he was going to have to stop doing it because his vision had deteriorated. He ended up getting re-registered with the Commission for the Blind, and he got adaptive computers and all kinds of equipment so that he could keep on doing his job. And we can provide training, like I said, if you have some devices that you need to get more familiar with in terms of their accessibility features. And we have career services also, training as well as placement. So for an individual, say, who may not be able to do the job that they had done before, we can help with developing career paths, as well as for people who haven't worked in the past. Now, the services that I've described in terms of low vision and occupational therapy, the first services I talked about, are actually now housed in a health center. We have a health center that's at our headquarters that provides most specialized services, including primary care. Now, we have a special sensitivity to helping people with vision loss, but it's not exclusive for people with vision loss. Anybody, in fact, we have a lot of people now that we're in a more residential, we're at 64th Street in West End. We have a lot of people who are local who are coming to us for everything, because frankly, our doctors are really good. It's a small health center, but it's very personal. So our low vision is there. Our occupational therapy. We also have physical therapy. And you see all the specialties there: podiatry, nephrology, neurology, behavioral health, and diabetes education. I'm going to talk about a little bit more. Diabetes now, and I mentioned a lot of people with glaucoma are diabetic also. Diabetes now is the leading cause of new cases of legal blindness in adults, actually ages 20 to 74. That's the statistic. What that means is most people who are diabetic, whether it's type 1 or type 2, after having diabetes for many years, 15, 20 years or more, usually develop something called retinopathy. I'm sure a lot of you know what that is. but it involves bleeding in the retina in the back of the eye. Not bleeding that you're going to see. Again, you know, it requires a professional eye exam in order to know that it's happening. But depending on where it is in the eye, if the bleeding isn't stopped, if it's in an area of the eye that's responsible for vision, it can result in blind spots. And there is treatment for diabetic eye disease now. The important thing is for the growth in type 2. Now, type 2 is at epidemic proportions now. And type 2, now, if someone has type 1 diabetes, they know it because they have to be on insulin. There are a lot of people walking around with diabetes. We have a talk we do on managing diabetes to save sight as part of an education campaign, because a lot of people with type 2 don't know they're diabetic. It means they're walking around for years without knowing it. More and more ophthalmologists are telling us that people are coming to them with a vision problem, and it turns out that it's connected with diabetes, and a lot of times these people don't know they're diabetic, which is really scary, because that means you don't develop an eye problem from diabetes unless you've had it for a long time. So it means they've been walking around for years without, there's so much you can do now. I mean, people with diabetes now can live as long as everybody else, can live at a pretty good standard of living, but it's important to not only monitor and take medications, insulin, but we know a lot about nutrition, about exercise that can help us stay healthy overall, but especially in terms of the progress. It can delay the progress of diabetes, and not just vision, but other complications. Now, based on that, we actually we started a diabetes center. We have a diabetes center that's part of our health center. It's accredited through the American Diabetes Association. We have a certified diabetes educator who's also a dietitian who helps people individually with nutrition plans, with exercise plans. There are also groups that can help people. The idea is to prevent vision loss and other complications where possible. And actually, even if you have pre-diabetes, I'll tell you my own thing. A few years ago, for the first time in my physical, I came into the zone of pre-diabetes. Fortunately, I had diabetes educators right there who I could talk to. And I'll tell you, she gave me a little bit of advice about changing my diet a little bit. And the next time I went back, I was no longer pre-diabetic. But we can help with that. We can help people who are diabetic to prevent complications. And if you're experiencing a vision loss, then we can also help with the introduction and instruction in the use of adaptive medical equipment like talking glucometers and other things, so that you can continue operating independently and taking care of your diabetes. We've actually been providing a lot of services now to dialysis patients, because many people who are dialysis patients are diabetic and are dealing with vision problems. So the whole thing is about whatever your health challenges, what vision and other health challenges might be, our goal is to help you to continue to conduct your life, or resume your ability to conduct your life the way you need to and the way you like to. With that, we also have a behavioral health service, which is the only psychiatric clinic in the country with a specialty in vision loss, which I find phenomenal. Mm-hmm. Also the fact that it was founded in the 1960s, when people didn't even really think about behavioral health. But we know that people who are experiencing vision loss, even if you didn't have depression or anxiety, you have a higher likelihood of experiencing that, sometimes on a short-term basis, due to the fact that you're going through a major life change and a loss. So our behavioral health service specializes in helping people with vision loss, but it's not exclusively for people with vision loss. We also have a specialty in traumatic brain injury, and as I mentioned, diabetes, as well as other chronic health conditions. So we offer specific services, individual, family, and couple psychotherapy. We have licensed clinical social workers, psychologists, and we also have psychiatrists, so that if you need medication, we have psychopharmacology. We can prescribe that in conjunction with the psychotherapy that you might need. We have groups, we have social services, and we do have availability 24/7. Another program that we have that is really kind of unique is our Guild Care Adult Day Healthcare Program. Now, there are other medical model daycare programs around the city, and that's basically people who need home care or would be eligible medically for going into a nursing home, but you want to prevent going into a nursing home. It's a program, actually, it's funded by Medicaid. It's totally paid for by Medicaid for individuals who have it, or some people come and self-pay. We have an adult day program at our headquarters on 64th Street. It provides transportation to and from, 2 meals, recreational activities, rehabilitative activities, and also access to all the other services in our building. We also have 3 locations in upstate New York. But we're deemed the only medical adult day program with a specialty in vision. Just so you know, we have services, as I mentioned, for people of all ages. So we do have, we see kids as young as little babies. You know, our range goes from little babies up to people recently 105 years old. We also have a national presence with telesupport groups for parents and teens. By the way, we are planning to develop telesupport groups for older, for adults also, and I'll keep you posted on that, because the model with parents and kids has worked out really well. Because sometimes if a parent is dealing with the challenges of a child who has vision loss, they may not know anybody for miles and miles around because it's not as prevalent in kids. So this helps to connect people. And we have also some of our vocational rehabilitation programs for youth and teens as well as at our headquarters. As I mentioned briefly, we do have professional training because we want to make sure that not just people who come to us directly, but if you're seeing nurses, social workers, case managers, we have online professional education in low vision, how to identify people who have low vision and what can be done to help the individual with low vision, whether it's in a care setting like a hospital or medical office, or just in actual other activities online. And we do provide some customized workshops, and we have some people rotating through our low vision service, actually from some major. We're working with New York Eye and Ear actually, so that their ophthalmologists are rotating through our low vision service. So, how do you access services at Lighthouse? When to seek services, just to kind of sum it up. If you're having any trouble with your daily activities due to vision problems, and you've been taking care of your vision in terms of going to the eye doctor, we want to make sure that it's not a new prescription you need in your glasses. We want to make sure you're getting everything that you need medically if you're still having an issue. If you have significant field loss, if your side vision is diminished, difficulties with contrast or night vision, like I said, and of course legal blindness. There's a slide here of a form that's in your folders, and I'm going to go over what's on this form. If you need a pen, there are pens in the back, but I want to go over this because if you're interested in connecting with our services, it's a very short functional vision screening, but if you're interested in connecting with us for any reason, certainly if you're having any problems, we want you to connect with us. But if there's anything specific that you'd like to access in terms of our services. So I'm going to read what's on the form, and if you want to fill it out, that would be great. Come to Lighthouse Guild for help with your vision problems. Because of your vision, do you have difficulty with any of the following? Reading the newspaper even while wearing glasses, moving around the house like bumping into things, cooking or using the stove, identifying money or paying bills, recognizing faces, and this last question on the screening is about emotions. Are you feeling sad, depressed, or anxious about vision loss? And to sum it up, if you have a vision problem that is interfering with your quality of life, please let Lighthouse Guild help. You can learn from Lighthouse Guild professionals how to be safe and self-sufficient in your daily life, at home, and in the community. Then there's one more question, since we have general health services. Have you had a physical exam in the last year? If you have, that's fine. If you haven't, if you're interested in working with us, if you don't have a regular doctor, and if you've checked off one or more yeses, or on the top questions, or if you want us to get in touch about any of our services, there's no obligation, but I would encourage you to fill out the bottom of the form with your name, address, phone number, and if you sign the bottom of the form, it just means that it's okay for us to call you. No obligation to enroll in any services. Coverage, this always comes up, so I've added a slide. We are a nonprofit organization. We also take we're a Medicare and Medicaid provider. We take about 37 different private insurance plans as well. As I said, people who are legally blind may be eligible to have their services sponsored by the New York State Commission for the Blind. And we also have sliding fees so that nobody who needs services will not be able to access them. And my last slide is thank you.